Today we will briefly discuss some hygiene aspects in wound care. In this video we will show you some examples of contaminated medical products that have caused serious harm. In some cases products are contaminated with pathogens during the manufacturing process. In other cases we as caregivers can contaminate products that are shared between different users. Let us look at some examples of products which were contaminated during the manufacturing process. In 2002 a large number of patients in Norway were infected with Pseudomonas aeruginosa from pre-moistened foams used for mouth hygiene in usually critically ill patients. About 50 deaths were thought to be related to these infections. In the United States, there have been a number of outbreaks where contaminated ultrasound gel led to severe intravascular infections after invasive ultrasound-guided procedures. Mycobacteria have been found in surgical markers that were supposed to be sterile. These markers are used to mark the skin of patients before surgery. The dye contains gentian violet, which actually is an antibacterial agent, yet some bacterial strains clearly tolerate this. The use of such contaminated markers has led to surgical site infections in some cases. This is yet another example of contamination of a product most caregivers would never suspect to be the source of contamination. One of the biggest outbreaks with Pseudomonas aeruginosa also happened in Norway. This Pseudomonas outbreak included 40 hospitals and over 380 cases of infection from October 2021 to May 2022. It is thought that the infections contributed to at least 8 deaths. The health authorities tested many products to find the source. It turned out to be a pre-moistened wet wipe, Oasis bed bath, imported from the UK. It is important that we do not contaminate products ourselves. One of the products that may pose the biggest risks of cross-contamination are non-sterile, disposable glove boxes. You do not need to be a rocket scientist to understand that the gloves at the opening of the box most likely are contaminated. These type of gloves have their use, but ideally not in a wound care clinic. Many studies have been done to check just how heavily contaminated these types of glove boxes can be. All studies show that a multitude of different pathogens are commonly found on the gloves protruding from the box, ranging from staphylococci to fecal bacteria. All studies confirm that regular glove dispensers pose a significant risk for cross-contamination. Again, these type of glove dispensers are not ideal for a wound care clinic. There are alternatives that minimize this problem. Safe-Don dispensers, for example, minimize the risk for cross-contamination by allowing only one glove to come out of the dispenser at a time. This is the type of dispenser we recommend in all settings where there is a high risk of cross-contamination. Be aware that we can also contaminate other medical products in our clinic. Typically this would be creams and ointments that we keep in store at the clinic. We can also contaminate liquids like local anesthetics that we aspirate from a vial. With correct procedures, you can quite easily avoid contamination of these products, but this is something your staff has to train on a regular basis. In summary, we hope you have learned that many types of medical products can be contaminated, and that this can pose a considerable threat to our patients. Especially Pseudomonas has the ability to survive in environments where we might not expect it to be present. In a wound care clinic setting, we can easily cause cross-contamination, but this can be avoided by following strict hygiene procedures.